Welcome to this special occasion in which we are honored to host the Health Cabinet Secretary and his team in our county. To all our guests, Karibuni, Kericho, and feel at home. Honorable Cabinet Secretary, ladies and gentlemen, let me begin my remarks by thanking you, Bwana Waziri, and your team for your consistent and tireless efforts in this war against COVID-19. Indeed, you have done quite an exemplary job, and I must sincerely thank you for that. As a county, as a country, we are living in one of the most challenging periods in the history of mankind, where we are faced with an invisible yet lethal enemy. However, with concerted efforts from all the stakeholders, especially the citizens, I am certain we will overcome this pandemic. Honorable CS, from the time COVID-19 pandemic containment measures were announced by your ministry, the county government of Kericho has worked round the clock to ensure compliance and adherence to the set guidelines and protocols. We began our journey by developing the COVID-19 County Emergency Contingency Plan, built the Ministry of Health guidelines, built on the Ministry of Health guidelines. We also constituted the County Emergency Response Committee drawn from both the National Government Administration officers and county government officials. The committee has been meeting twice weekly and working closely with the Health Technical Committee. With the close cooperation from the two committees, the Department of Health has actively undertaken the following activities. 1, sensitization and training of our health care workers, which is at 95%, health education to members of the public, screening at the entry points to all our health facilities, screening of travelers passing through Kericho, contact tracing and follow-up, quarantine of suspects at KMTC Kapkatet, testing of suspected cases, isolation of confirmed cases, testing of healthcare workers, protection of frontline healthcare workers, recruitment of additional 126 healthcare workers beside the 176 universal healthcare recruited staff, production of hand-washing detergent and face masks to support the needy population. Ladies and gentlemen, as you are aware, Kericho is a COVID-19 testing center, working in partnership with KEMRI, Walter Reed Project, which is a laboratory supported by the US government. We in turn support a number of counties in testing their samples with a turnaround time of 24 hours. The laboratory has a testing capacity of 8,000 samples a day. However, the main challenge we are experiencing has been the availability of testing reagents. So far, a total of 5,084 samples have been tested, out of which 2,011 are for Kericho County. And this yielded 111 positive COVID-19 cases. This translates to a 5.4% positivity. As of today, we have a total of 17 patients in our isolation ward and 46 patients on home-based care. All are in stable condition. We are happy to report that 20 patients have recovered. But on a rather sad note, 2 cases were found to be COVID-19 positive posthumously. Ladies and gentlemen, my government through the Public Health Department has also interned a number of residents who have succumbed to COVID-19 while being managed in other centers across the country. To the skeptics, what further proof would you need to accept that COVID-19 is real? Ladies and gentlemen, based on the projected epidemiological modeling issued to counties by the Ministry of Health, my administration has set aside 308 beds for isolation of confirmed cases. Our isolation centers are at Kericho County Referral Hospital, 200 beds, Ainamoi COVID-19 Hospital, which is here, 60 beds, Unilever T Kenya Central Hospital, 19 beds, James Finlay's Kenya Kipketer, 29 beds. On that note, I wish to most sincerely thank Unilever T Kenya, James Finlay's, and all private health facilities which have partnered with us in ensuring that we have enough isolation beds in our county. Ladies and gentlemen, we also have 8 ICU beds with 6 ventilators in the public health facilities and 7 ICU beds with 5 ventilators in the privately owned facilities. Bwana Waziri, I wish to kindly request you to assist us with an additional 10 ventilators to bring to a total of the recommended 16 ventilators to be used in the public sector facilities that admit most of the COVID-19 patients. Ladies and gentlemen, I wish to reiterate our commitment in ensuring public health safety to the citizenry of Kericho County and the entire nation at large. We welcome on board all stakeholders with full assurance that any support given shall be diligently put into good use, and I, without blinking an eye, affirm to you that utmost accountability measures have been put in place pertaining all donations, all grants, all monies appropriated for COVID-19. Ladies and gentlemen, as I conclude, allow me to take this opportunity to laud the commendable efforts of the healthcare workers in managing COVID-19 and in equal confidence affirm my government's support to them during this difficult time of the pandemic. Indeed, it is a sacrifice and a higher calling to serve humanity at its worst. As we continue fighting this pandemic, let us remain united and strictly adhere to the guidelines from the Ministry of Health. Hand hygiene, keep social distance, always wear face masks in public places, avoid social gatherings, stay at home, and Bwana Waziri, you usually forget to say, don't touch your nose, don't touch your eyes, and don't touch your mouth. Stay safe. So wananchi wa Kericho, if you continue behaving abnormally, this disease will teach you to behave normally. So thank you. God bless Kericho. God bless Kenya. It is now my humble duty to welcome my brother, Cabinet Secretary for Health, Honorable Mutahi Kagwe, to give his remarks. Thank you.
Thank you very much, Your Excellency. Your Excellency, Professor Paul Shipkwani, Governor of Kericho County, the Deputy Governor, Your Excellency Susan Kikwai, County Executive members and members of the Kericho County Assembly here present, my friends from the Fourth Estate and Kenyans at large, Hamjambo. Shamwe. It is a great honor, Your Excellency, to be here in Kericho, the home of our internationally renowned tea. I'm coming here also traveling from Kisumu, where I had a similar visit, and I must confess that the drive here was thoroughly enjoyable. Indeed, Your Excellency, when life returns to normal, I want to encourage as many Kenyans as possible. Just take a ride here, and that's a good holiday. It's a good holiday, and I want to really encourage our people to see their own country and take advantage of what God Himself has blessed us with, because this can't be man. This is God's land. And we are grateful as a people that we have such a beautiful land and a nation of people with innate goodness. Having just visited Kisii, Kakamega, and Kisumu, I'm also grateful that we have food security in these regions, and that here in Kericho, where you rely heavily on tea, our tea exports have continued to do well despite the epidemic, as you mentioned to me this morning. This has given the people of Kericho a sense of economic normalcy. In times as these, one cannot take that for granted. And also, let's not forget that good eating also informs the immunity that we need so seriously in order to fight this pandemic. When a governor, as you know, we are here also to assess your country's level of preparedness and the overall status of healthcare, which is impressive. It is gratifying to see firsthand the developments, including the equipping of health facilities in the county, such as Kericho County Referral Hospital, which has been refurbished. I am also pleased to note that all the critical care equipment in your facilities, some of which were delivered a while back, remain functional, and this is as it should be. In fact, when the governor, I was so pleased to hear that this is one area in Kericho where the referrals have reversed, and the private sector hospitals are actually referring people to the government facilities and paying for them rather than the other way around. That is a real achievement, and I want to congratulate you and your team and to say keep it up, and it is something that the other counties across the country should look at with envy and hopefully adopt and copy. When it comes to COVID-19 and your approach to it, I must also let Kenyans know that you are an unsung hero. At 116, your number of infections is relatively low as compared to many other counties, but you nonetheless put in place numerous initiatives that are worth commending. Here, I first note the critical support that your county, in collaboration with KEMRI, is offering other counties on COVID-19 testing, including Busia, Kisii, plus of course your neighbors, Nandi, Narok, among others. I'm also impressed by the manner in which you have mobilized the private sector in your government's fight against the pandemic. It is uplifting to visit a county where private business have partnered with the government and where they have made significant monetary and in-kind contributions. When a governor, speaking of support from the business community, it would be good to note and to recognize the Unilever Central Hospital, where one of your country's isolation centers is located. The center has been set aside to cater for your health care workers who contract the coronavirus, and I note that it has so far attended to 11 of our healthcare workers, 7 of whom have now gotten better and continue to recover on home-based care programs. On behalf of my ministry, I would like to take this opportunity to thank these establishments for offering us support and encourage the business community elsewhere to emulate what the people of Kericho are doing. And Your Excellency, I also wish to recognize the institutional relationships that exist between some of the counties that we are visiting and the county governments. Of note is universities such as Maseno collaborating with the Kisumu government to create a core center, and we wish to appeal to institutions of learning, especially higher institutions of learning, again emphasizing on those with medical training capability to please volunteer their services to the county governments and help them in all manner that they can. Institutional cooperation can help reduce the burden that clearly is visiting the county governments. Separately, it is worth mentioning that as a county government, Kericho has put a lot of thought into the country's COVID-19 approach. The establishment we are presently at, Ainamoi, Health Isolation Center is but one of the 4 such facilities that the county has set up in preparedness efforts. Each facility has been well equipped, and I'm glad to note that you have set aside a ward for the exclusive use of expectant and lactating COVID-19 positive mothers. I'm even told that you are prepared for maternity services here in Ainamoi should a COVID-19 positive woman need the services. We are told that God created mothers because he would not be everywhere at the same time. And this is why we appreciate our mothers. But it is not often that we single them out through small acts of kindness. And for this kindness, I thank you, Your Excellency Governor, you and your team, for this consideration of our mothers and beyond it, those with social challenges in your county. Speaking of challenges, the ministry has noted that in this county, and indeed throughout the nation, stigmatization is still a problem. Here, and in the spirit of sensitization, I would like to make a heartfelt appeal to Kenyans to learn a bit more about coronavirus. As much as COVID-19 is a highly infectious disease, should one contract it, it is not in itself a death sentence. And like any other disease, it will be managed by our healthcare workers to the extent possible. In any case, we now know that the majority of our people who contract the disease are asymptomatic. And even where there have been symptoms felt, our patients have recovered, a lot of them. When people recover, they no longer shed the virus, and therefore there is absolutely no reason to stigmatize anyone who, for whatever reason, contracted the disease. I hate to repeat it, but you can get it, I can get it. You can get it too. So don't sing a song of anybody who is sick and make it a negative one. Let's be positive. And in addition to that, I would also urge those of us who contact the virus, don't hide it. Don't hide. It's no biggie. Don't hide it. Let the people know. If you have got friends and so on, let them know that you are staying away in isolation because you have got COVID-19, and sooner than later it will be all over. So there is no reason to go out of your way, as we were saying yesterday, for doctors to hide that you are not COVID-19, for you to deny that you are COVID-19, even when we know for a fact that you have got COVID-19, for people to pass away with COVID-19, and we want to deny those facts. You know, this is not necessary because it is an infectious disease, and there is no reason for anybody to shy away or feel that they have got anything that other people don't have. It is just a disease that we can fight, and I'm convinced that Kenya will fight and win a war against it. So even those health facilities who see patients presented with COVID-19 symptoms, test them, find them positive, and then fail to report to anyone, including the patients themselves sometimes, just to avoid the stigma. I think they do a serious disservice, not only to the people they test, but you can imagine, you know very well that that person is positive, you allow them to go home and interact with their loved ones freely and unknowingly putting them to risk. So if you test somebody and they are positive, inform them. It is the right thing to do in the shortest time possible so that they can isolate themselves or present themselves to isolation facilities. So I want to say that if there are such institutions, especially private institutions, that are doing those kind of things, and some of them have been flagged out by our medical teams, I think it is not fair, and let us stop that practice. Please, stop that practice. We cannot allow unscrupulous behavior that is harmful to our public health to continue. And as a ministry, we are committed to taking serious action against such violations. Patients deserve to know their status in order for them to protect themselves. it is compulsory that all positive COVID-19 positive cases be reported to the Ministry of Health. And this is not a negotiable issue. This is the state of affairs. This is what we have said. This is what we have declared in terms of Public Health Act, that it is a must that we must report cases that test positive. And for the sake of our great country, the responsibility to report these cases cannot be overstated. So I would like to urge, nataka kuwasihi kila mtu, sana sana mahospitali, clinics na wengineo, kama mtu ameambukizwa na wewe umefanya test na unajua hiyo ndio ukweli, tafadhali ni lazima upige report kwa Wizara ya Afya, kama ni hapa kupitia the county government and the directors of health, so that we know exactly where it is happening and where it is happening, and we can advise our people. Fellow Kenyans, switching on and moving on to the latest results, today we have 492 more COVID-19 infections out of a sample of 4,063 over the last 24 hours only. In total now, the confirmed numbers are 26,928, while the cumulative tests stand at 358,330. Among the new cases are some 478 are Kenyans, while 14 are foreigners. Once again, male 331, when we have got 161 women. The youngest confirmed case is 11 months old infant, and the oldest is 83. And just to report about the infants, we continue to have this infant positivity. And again, I would like to appeal to mothers and those people with small children. Please limit the number of visitors you are bringing to the house. If you have got an infant, just limit the number of people coming. Kama tulivyosema hapo beleni, hapo awali kidogo, mimi najua mtoto akija nyumbani zetu tuna furaha kubwa, na kwa hivyo wageni ni wengi. Sana sana kina mama wale wanakuja kumsalimia huyu mgeni ambaye amekuja kwetu, na hiyo ni sawa kabisa. Lakini tumesema na tunawasihi kwa wakati huu, wachani tugoje kidogo. Tumesema kama una hiyo hamu sana, ukiwa na hamu sana ya kusalimia mtoto, na unajua wewe ukienda huko ni kitu unataka kupeleka, tumewauliza kina mama, tuma M-Pesa. Tuma M-Pesa, hiyo ni sawa. M-Pesa haitalete virusi, na baadaye utaenda kusalimia mtoto, na hiyo wakati huo mwingine utamletea kitu kingine bado. Kwa hivyo tafadhalini, please let's protect infants. It's critical. I'm also pleased that some 534 patients have recovered and have been discharged. Amongst those, 56 were from different hospitals, while 478 were in the home-based care program. And this is a phenomenon that we continue to observe, where home-based care programs are better, people are getting better faster, and so far, so good. This brings the total cumulative discharges to 13,485. Pongezi sana kwa wahudumu wale wa afya kwa kazi yetu ile nzuri ambayo ndio itaitufanya tuendelee vile tunaendelea wakati huu. On a sad note, I regret to inform you that we have lost 3 patients to COVID-19 complications. Natuma rambirambi zangu kwa familia na marafiki wa wale ambao wamepoteza wapendwa wao. In terms of, just briefly, in terms of highlights, in terms of the higher reporting counties, Nairobi again, 357 cases. Garissa has got 52 cases. Kiambu has 37 cases. And going back to Garissa, I think it is very, very important that Garissa, Wajir, Mandela, and the counties that neighbor our brothers in Somalia be on the lookout and really, really be careful, because we have no doubt that there are cases coming from the neighborhood. So Kiambu has reported 37 cases, Kajiado 14 cases, Machakos 10 cases, Busia 5 cases, Baringo 3 cases, Embu 3 cases, Mombasa 3, Muranga 3, Kilifi 2, Isiolo, Makueni, Uasin Gishu has 1 case each. So we want to say that in your case, for example, in the case of Kericho, if we can contain the disease, all we need to do here is contact trace, real contact tracing, and real isolation, whether home-based isolation or whether institutional isolation. But the stage of your disease, where the disease is at here in Kericho, is such that it can be contained, so that we do not have a wide community spread, because you are at a stage where it's possible to contain it. So, Your Excellency, I don't want to go into other details which will be given to the media in terms of the places that have got the highest cases, whether in Kajiado or Mombasa or Nairobi. But I want to once again thank you most sincerely. I want to once again say we are very, very impressed. You asked us for some support in terms of getting ventilators. Indeed, we will support you. We would like to urge that you grow your ICU capacity a little bit, maybe to about 30 ICU beds, just in preparation. Now, those people might wonder, why are we increasing our capacity, yet we have got such low levels of infections? Better be ready than sorry. One of the things that has happened since March 13, is that what we have been doing is ensuring and building capacity, so that even if we get to the point where cases increase, we are not going to be overrun. And I want Kenyans to really look at the examples from Europe. What happened in Italy, what happened in Spain, and what happened in South America, in countries like Ecuador. What happened is that they were so overwhelmed that people would die in rooms, in houses, and all they could do is take them out of the house, pour paraffin on them, and burn them, because of how they have been overwhelmed. You will remember, again, the same thing happened in Italy, because the curve went very steep upwards and just about wiping people out. So the important thing here is to be as ready as possible, and we pray and hope that we do not have to use these facilities. But even if we don't use them for COVID, look at how nice this hospital now looks. You know, so the people from this area, we will no longer need to go to the district. Post-COVID, si ni hospitali yao sasa. Si iko na vitanda na kila kitu. Kwa hivyo, there's a silver lining. There's a silver lining to these things, and our healthcare structures across the country will be so much better. And therefore, in terms of implementation of universal healthcare, we are that much far ahead just because of this disease that presented itself. So I want to thank you, Your Excellency, and your government and your people. I want to continue thanking our healthcare workers. I want to thank those in labs, in Kemri and elsewhere, who are continuing to do research, who are continuing to support us, who continue to risk themselves. I was there just now. There are areas they won't let me go, thank God. And, you know, we know that you are sacrificing, and we appreciate. As a nation, we owe our healthcare workers. Thank you very much. I would like now to take this opportunity, Bona Governor, just to say that as we came, as you can see, I didn't come on my own. I think the people of Kericho should also see some of the people behind the scenes. The CEO of the Nursing Council is here with us, Edna Talam. Mpigiani makofi Talam, tafadhali. She looks after it is important for the nurses to know how much we recognize how much we recognize them. And that's why Edna Talam is here. Dr. Wafa Osman. Dr. Wafa is head of the Directorate of Health Partners Coordination and Intergovernmental Relations. Asante sana daktari. Susan Koki Mutua. Where is Susan? Susan is the head of Public Health Department. There is also, she is standing over there, she didn't join us here. Rose Modibo, who is Director for Liaison. And of course, Dr. Patrick Amoth, who is Acting DG, Ministry of Health. Your Excellency, it is also tradition that when an African goes visiting a mzee like you, who is respected, either I bring a goat or something. And today, instead of the goat, I brought some 3,500 PPEs so that your health workers can also benefit from the support we are giving. But that will not be all. I am also aware, Your Excellency, that you are very keen on upgrading your level 4 hospital in Kericho to level 5 hospital. And I know that you have invested in the hospital sufficiently for it to be upgraded to the levels that you are looking for. And the council, I am going to send the council to come and assess, and the following success of that, we will upgrade your hospital. I am also aware, Your Excellency, that following President Kenyatta's intervention and your generosity, that you set aside some land which was left aside for some level 6 referral and teaching hospital here in Kericho, and I know that the land is there. And I just want to tell the Kericho people that the president has not forgotten this. In fact, he told me, when you get there, salimia watu na uambie hajasahau. He has not forgotten. It's just the challenges of COVID and so on that has not made us come here and start working on that project. So I want to thank you most sincerely, and now give my friends from the 4th Estate an opportunity for clarification and any questions that you might have. And I would also like you to, sorry.
My name is Kigodo Mwangi from K24 and MediaMax. Bwana Waziri, want to thank you for the dedication that you have had in the ministry. And when you started by saying that you'll deal with the cartels. We still have the same problem, even as today we are speaking. We still have the same problem from KEMSA to the Ministry of Health to the tendering process. When are we going to have a clean Ministry of Health? Second, you have been moving around the country assessing the state of our health care facilities. Have you known that some governors around the places that you have visited are borrowing beds from other facilities, private facilities? Once they have shown to you, they take it back. And once they do that, those people who remain with the problem are the residents. That is something that is a fact. And I was asking, is it possible that you send your people undercover so that you establish if indeed the beds that you have been shown, they belong to that hospital or they were borrowed? And the last one is, we saw the government issuing sanitizers and masks to the citizens for free. We have not seen them here on the ground. We just saw them being launched, and from there we never saw those, maybe to the PSVs, maybe to the markets. What is not happening? Who is the supplier, and who was mandated to maybe supply to the citizens so that they can be able maybe to sanitize themselves? Because 50 shillings to a mamamboga, 50 shillings to a boda rider, 50 shillings to a herdsman outside there, it is something that they cannot be able to afford. As a government, it is your mandate to protect the lives of Kenyans. Thank you.
My name is Kimutai from The Nation Media. Kericho World Rate and Cambry Lab has a capacity to test 8,000 samples in a day. 4 months down the line, it has only tested 5,000. The problem has been the lack of reagents. What is the ministry doing to ensure that the reagents are available? We have had the same problem the other day in Kisumu, Cambry, which stalled the process of testing. So what is the ministry doing to ensure that Kericho has enough reagents so that it can assist the neighboring counties? 2, the health workers. There is a surge in the number of infections of health workers countrywide. When you talk to the health workers, they say the problem is the lack of PPEs. What are you doing to ensure that indeed what is given by the national government and what is purchased by the counties indeed gets to the health workers? Lastly, the spike in numbers in the hospitality industry, looking around the counties, the opening up of the country, we've told the hospitality industry to test their, but the industry players saying the cost of testing in private facilities is costly. It's most prohibitive. Is there a possibility of government allowing the doing mass testing for the health workers in Cambry for free? Thank you.
I'm Masi Kahenda from The Standard. My question goes to Waziri. You've advised mothers to take care of their infants, and I would like to know perhaps currently what's the total number of infants and children who've contracted COVID-19, and what's the recovery rate? Then another question is, you've been going around the counties assessing COVID-19 preparedness. What's your take? What's your assessment so far in terms of county preparedness in handling this coronavirus? Thank you.
Asante.
Well, my name is Alan Ochana from KTN. Bwana Waziri and Bwana Governor, maybe Bwana Waziri, we've been with you in Nyandarua, Nakuru, and now here in Kericho, and we've also been in other parts of the country. And there is this culture where governors were actually touted as the first line of defense by the president, and they were given the minimum expectation of just equipping 300 isolation beds. And as my colleague Kingodo Mwangi said, that maybe some governors could not be having tangible isolation beds. From your end, the visits you've been making to the counties, have you done your due diligence to ensure that we have those tangible beds in those isolation facilities in the various counties?
Thank you. Asante. Thank you very much. Let me start with the last two. I think the last one and the first one were very close together in terms of the number of beds and the possibility that there are some governors who are essentially pretending that they have bought beds and then they have taken the beds back once we have seen them. First, I am not aware of such a governor. Secondly, considering where you are asking from, you are a member of the Fourth Estate. The Fourth Estate, in addition to ourselves, can be able to carry out very thorough, and we have seen them do it, carry out very thorough investigations and find out exactly where the beds were taken from, which hospitals got them, at what point they were taken back, including it were carried by a lorry, vehicle number KT something, back to the owners of the beds. I would be very keen myself to find out, and I think Kenyans would be very, very keen to find out if something like that was going on. And I think there are several institutions that can do that. One of them is the Fourth Estate, the other one is DCI, the other one is the ministry itself. But at the ministry, I must tell you, that we have not heard of such an activity. And it would be interesting, also, given social media and given the activities in the social media, I would like to imagine that if something like that had happened, it would have been flagged very, very seriously in social media. On the issue of cartels in the ministry, you know, we are fighting cartels. But I would also like you to be patient. You have been patient for a very long time when you have been with those cartels. So be a bit more patient during the fight against the same cartels. Cartels are not beaten overnight. They fight back. And I am not going to be explaining every day and telling Kenyans, this is exactly how you are fighting a cartel. How do you disclose your strategy to your enemies when you know they are going to come for you? So let me just put it this way. We are committed. I am personally committed to ensuring substantive changes in the ministry. However, even the changes that we have made so far, and we have made substantial changes, are not getting the kind of appreciation that might be there. Long story short, we are determined, whether in KEMSA, whether in the ministry, whether in anything connected with the Ministry of Health, we are determined that this be done. And I think you are even, you have no idea how bad it is. You are just mentioning KEMSA here. And you are mentioning something, Ministry of Health, in passing. My friend, blood from the ministry has been found in Mogadishu. Blood. And here you are taking it lightly, talking about what you have done in 5 months. It's not an overnight activity. We are determined to fight. And we will. So if you know any of those cartels, please tell them that their days are numbered. On the issue of the tests, yes, it is true that I am pleasantly surprised at the capacity that Kemri Kericho has. In fact, Kemri Kericho is a hidden gem because there is so much happening here, which I honestly, had no idea. I knew they would test, but I didn't know just how efficient and effective this institution is. And yes, they can test as much as you had said, 8,000, but they have to have the reagents. Now, on the issue of the reagents, it is a global concern. It's a global challenge. It is not that the Ministry of Health is not fighting to get these reagents. We are fighting as much as we can. Don't forget, we used to test 100, 200, 300 people per day. Now we are on to 4,000, 7,000, 8,000 even. It is according to the availability of the reagents. When we get the reagents and we are searching for them across the globe, there is no place where we don't have people, where our embassies are not fighting. For example, in the United States, where the reagents for the machines here come from, you know what is happening in the US. They have got a serious problem there, COVID-19 problem. So obviously what they are doing is using the reagents for testing their own people before they release the reagents to us. And that's why we have kept on saying, going forward, let Kenyans know we need to have our own local production of pharmaceutical products. And I even say that even if our products are slightly more expensive, if our production costs, because our volumes are less, our production cost is likely to be higher. But even if our production cost is higher, even if we buy at slightly more money from our local manufacturers, let it be so. We have learned that you can have money, pocketfuls of it, and yet you don't get the reagents. So I would like to say that we are doing everything we can to assess those reagents, to access them, but it is not easy. And it is not a Kenyan issue, it's a global concern. On the issue of health workers and the PPEs, it is true that it is possible that, and there are 3 possible scenarios. One of them is that the use of the PPEs themselves. You can have a PPE, but you have to use it yourself and you have to use it properly. That's number 1. But number 2, as we have just been told here by the Kemri leadership, is that indeed even here they had 2 cases that were positive. But they also pointed out that the positive cases they didn't get the positive cases here. Because all our health workers, just like me and you, we live in a community. And it is possible for you to get it even in the village. You don't have to get it in the hospital. So yes, I mean, as much as we flag out the healthcare workers because of their importance to us, but it is also a fact that it is not just in the hospitals that a healthcare worker can get the positive, can go into positivity. Mercy, you asked a very good question regarding the infants, and I would like to ask Dr. Amoth to respond to that, as well as the spikes in that one. But I would like also to say that that's an extremely important issue. It's an extremely important issue to us, because obviously what you don't want is infants getting sick, because that means that between the infant and the mother, they will continue with that trading of who is sick at what point. So let me ask Dr. Amoth to respond to that particular issue, and perhaps the ones of Spike, and then I'll hand it back to the governor, who may want to say something.
Thank you, CS, Excellency Governor. It is actually not true that there's been a spike in workers in the hospitality industry, and that is the reason we stopped testing hotel workers for COVID-19. Because if you look at the magnitude of the test we did, vis-a-vis the number who turned out positive, it was not making business sense. So that is why we decided to change our testing strategy, which we are now rolling out, basically focusing on positive cases, close contacts of those positive cases, of course, frontline healthcare workers, because of the risk they are exposed to when they offer the services, people in the transport sector. Of course, the transport industry is very, very important, moving huge volumes of people from one place to the other. Security people, those with chronic or existing conditions, those in old people's home. These are the people we are trying to focus on now as we roll out our new testing strategy. But testing, of course, is very important because it unravels the magnitude of the disease, and it also informs the interventions that you take going forward. Because it's only through testing that you'll identify that positive case, trace the contacts, isolate them, and manage those with severe and moderate disease, and therefore break the chain of transmission. Our testing capacity is now about, per capita, is 6 per 1,000 people. Then it goes to 71 per 10,000 population and 705 per 100,000 population. In fact, Kenya, when we started, remember when we started, we used to take our samples to South Africa, the National Institute of Communicable Diseases. And sometimes it would even take 3 days before the samples reach Johannesburg. Now we have more than 32 testing facilities, both in public and private. And this has ramped up our capacity. In the top 15 countries in terms of testing in Africa, Kenya is amongst them. And as Waziri has highlighted, the main challenge is global supply constraint of getting the reagents. And the only solution going forward is to be able to locally manufacture those reagents. And that is what we have tasked our premier research institution, KEMRI, to look for going forward. In terms of the actual figures of infants and children, I may not be able to give you that figure here, but I can be able to share it with you once I talk to my team. But children and infants do very, very well despite exposure to COVID-19. Of course, infants mainly get exposed because their parents, especially mothers, during breastfeeding. So far, we have only lost one infant, a 6-year-old, who had a problem with a bone marrow, a condition called aplastic anemia. So they get the disease, but they weather the storm very, very well. But that notwithstanding, of course, we still espouse breastfeeding as the best food for the baby. So even if the mother is positive, the mother must breastfeed. I also wanted again to highlight on the issues of home-based care, what you need to do at home when you are under a home-based care program. You need to get adequate nutrition, get foods from all the groups, especially proteins are very important, both animal-based and plant-based protein, be it dengu, be it lentils, beans, be it meat or poultry, be it fish and fish products, because this is important information of your, or activation of your immune system to be able, for your body to be able to weather the challenge of SARS-CoV-2 infection. You also need green leafy vegetables, fruits and vitamins because they'll give you micronutrients, antioxidants and trace elements like copper, manganese, molybdenum, zinc, which are important in building up your immunity. So you go ahead, take your ginger, lemon, garlic, that concoction. Number 2, ensure that you are properly hydrated, take at least a minimum of 2 liters of water per day. This helps cleanse your system. And the only way to be able to know that, even if you don't have a measuring jug, is when the urine is clear like tap water, then you know you have taken adequate amount of water. Number 3, you require adequate sleep, 6 to 8 hours of sleep, for your body to be able to heal and rejuvenate because you are fighting a serious infection. Number 4, you need to exercise at least 30 minutes of exercise, including just brisk walking in your compound. This will also enhance your immunity. And of course, you require psychosocial support from the healthcare workers and members of your family. You also require vitamin D. You bask in the sun 30, 40 minutes, especially early morning. That enhances formation of vitamin D, which will further enhance your immunity. Of course, avoid use of tobacco, alcohol, and other recreational drugs, including Mira, Kuber, and any other medicine, or any other drug for that particular matter. Then finally, I wanted to talk about how people get back to work after a diagnosis of COVID-19. This is a question that was not asked here, but it has been trending in social media. We have 3 criteria. Criteria 1 is based on your symptoms. There are 10 days after the onset of your symptoms, you should not be having fever, and you should not be using any medicine to reduce your fever, like paracetamol or Brufen. And if you are having cough or difficulty in breathing, for the past 3 days, those symptoms ought to have improved. So if you have 10 days of a positive COVID-19 test and your symptoms are improving, you don't have a fever, you don't have to take medicine to bring your temperature down, then you are good to go back to work. But ensure again that you maintain the same infection prevention control measures, including physical distancing, frequent hand washing, and of course use of sanitizers, and you wear your mask and wear it properly. Please, my appeal, fellow Kenyans, let's wear our mask properly. Don't wear your mask on your chin. You don't breathe through your chin. Criteria number 2 is what we call time-based. So this applies to those who are symptomatic. Like today, you get tested for COVID-19. You don't have any symptoms. It's just that you went to Walter Reed in Kericho, you are tested, you don't have any symptoms. 10 days after that test, if you don't have further symptoms, then you are good to go back to work. Criteria number 3 is what we call the test-based criteria, where 10 days after your COVID-19 test, you have repeated a test for COVID-19, it is negative, you repeat again after 24 hours, it is negative, then you are good to go back to work. But again, ensuring that you put into practice all the infection prevention control measures. Criteria number 3 is not favored because it puts our capacity to a huge challenge because you require multiple tests. And remember, even if you are healed, you could still test positive for COVID just because you are secreting a dead virus that is not contagious. So criteria 1 and criteria 2 are the ones that we espouse going forward. I thank you.
Thank you very much indeed. Alan, I think, is it Alan who is, I think, what was it that you had asked which I will give? Yes. I will now invite the governor to respond to anything that he might have wanted to do. Thank you very much.
Yes, mniruhusu tu niwatambue wenye wako hapa na nitasoma majina yao. MCA wa hapa Ainamo Cheruiyot yuko na sisi, Honorable Ngetich Daniel yuko na sisi. Dennis Kirui mheshimiwa yuko na sisi. Emily Kerich mheshimiwa yuko na sisi. Mheshimiwa Eric B ambaye ni vice chair wa health committee yuko na sisi, na chair mwenyewe yuko hapa. Deno yuko hapa. Mheshimiwa Eric Oske yuko hapa. Mheshimiwa Honorable Kasim Abdul yuko hapa. County Commissioner yuko hapa, Bwana Kamau, asante. Deputy Governor yuko hapa. Waziri wa Afya Dr. Mutai yuko hapa. CS Bet yuko hapa. Chief Officer Health Wanekwam yuko hapa, na Chief Officer Public Service Management yuko hapa, Stephen Cheruiyot. Asante sana.
Thank you all very much indeed. Thank you.